Cisplatin chemotherapy drug, uses, side effects, and precautions. Cisplatin is a platinum-based chemotherapy medication that has been a cornerstone of cancer treatment since 1978. This powerful anti-cancer drug is commonly used to treat various solid tumors including testicular, ovarian, bladder, head and neck, lung, and cervical cancers. Cisplatin has demonstrated remarkable effectiveness, particularly in testicular cancer where it has significantly improved survival rates and cure rates. What is cisplatin? Cisplatin is a coordination complex of platinum with the chemical formula Cisptnh32Cl2. It belongs to a class of chemotherapy drugs called alkylating agents and contains the metal platinum, which gives it its unique anti-cancer properties. The drug is administered exclusively through intravenous injection as a sterile solution and requires careful monitoring during treatment. What are the benefits and uses of cisplatin? Cisplatin offers significant therapeutic benefits for cancer patients, particularly when used in combination with other chemotherapy drugs. The drug has shown remarkable efficacy in treating multiple cancer types and has become an essential component of many treatment protocols. Conditions cisplatin treats. Cisplatin is FDA approved to treat several types of cancer. Testicular cancer, often used in combination with bleomycin and etoposide. Ovarian cancer, frequently combined with cyclophosphamide or other agents. Bladder cancer, used as both single-agent and combination therapy. Head and neck cancers, including esophageal cancer. Lung cancer, both small cell and non-small cell types. Cervical cancer, often combined with radiation therapy. Breast cancer, in specific treatment protocols. Secondary uses of cisplatin. Beyond its primary indications, cisplatin is also used to treat mesothelioma, all four subtypes including pleural, peritoneal, pericardial, and testicular. Brain tumors, including certain types of neuroblastoma. Sarcomas and lymphomas, various subtypes respond to cisplatin-based regimens. How does cisplatin work? Cisplatin's mechanism of action involves a complex process that ultimately leads to cancer cell death. The drug works by interfering with DNA replication and repair mechanisms. Once administered intravenously, cisplatin remains stable in the bloodstream due to high chloride concentrations. Upon entering cancer cells, the drug undergoes aquation, where chloride ions are slowly replaced by water molecules. This process creates an electrophilic compound that has a strong affinity for DNA. The activated cisplatin then binds to the N7 reactive centers on purine bases, particularly guanine residues in DNA. This binding creates DNA crosslinks between adjacent guanine molecules, which prevents DNA replication and transcription. The DNA damage triggers cellular repair mechanisms, but when repair fails, the cell undergoes programmed cell death, apoptosis. Cisplatin dosage. Cisplatin dosage must be carefully calculated based on the patient's clinical condition, body surface area, renal function, and response to treatment. The drug requires precise administration to maximize therapeutic benefits while minimizing toxicity. Typical dosage instructions. Metastatic testicular cancer, the standard dose is 20 mg per square meter 4 daily for 5 days, repeated every 3 weeks in combination with bleomycin and etoposide. Advanced bladder cancer, 50 to 70 mg per square meter 4 per cycle every 3 to 4 weeks, with initial doses of 50 mg per square meter recommended for heavily pretreated patients. Metastatic ovarian cancer, 75 to 100 mg per square meter 4 per cycle every 4 weeks, typically combined with cyclophosphamide at 600 mg per square meter. What should I do if I miss a dose? If you miss a scheduled cisplatin dose, contact your doctor or pharmacist immediately for a new dosing schedule. Never attempt to double doses or self-adjust the timing, as cisplatin requires precise scheduling to maintain effectiveness and safety. What happens if an overdose? Cisplatin overdose is a serious medical emergency that requires immediate attention. Healthcare providers exercise extreme caution to prevent inadvertent overdosage, with special warnings for doses exceeding 100 mg/m² per cycle. Symptoms of overdose. Overdose symptoms may include severe kidney damage, hearing loss, severe nausea and vomiting, and dangerous drops in blood cell counts. Seek emergency medical attention immediately if overdose is suspected. What to avoid? Avoid aluminum-containing equipment during preparation and administration, as aluminum reacts with cisplatin, causing precipitation and loss of potency. What are the side effects of cisplatin? Cisplatin is associated with significant side effects that require careful monitoring and management. While effective against cancer, the drug can cause both common and serious adverse reactions that patients and healthcare providers must be prepared to address. Common side effects. The most frequently reported cisplatin side effects include nausea and vomiting, often severe and requiring antiemetic medications. Temporary hair loss, usually reversible after treatment completion. Fatigue and weakness, can persist for weeks after treatment. Diarrhea, may require dietary modifications and medications. Loss of taste, can affect appetite and nutrition. Dry mouth and skin, requires increased hydration. Hiccups, usually temporary but can be persistent. Decreased sweating, may affect temperature regulation. Serious but rare side effects. More serious adverse reactions that require immediate medical attention include kidney damage, nephrotoxicity, can be permanent and dose-limiting. Hearing loss, ototoxicity, may be irreversible, especially high-frequency hearing. Peripheral neuropathy, numbness and tingling in hands and feet. Blood disorders, including anemia, neutropenia, and thrombocytopenia. Allergic reactions, can include anaphylaxis, especially with repeated doses. Heart rhythm changes, including fast, slow, or irregular heartbeats. Patients should consult their doctor immediately if any symptoms worsen or if they experience signs of serious side effects such as unusual bleeding, vision changes, hearing problems, or symptoms of infection. Precautions and warnings. Cisplatin carries several black box warnings due to its potential for serious toxicity. Healthcare providers must carefully evaluate patients before treatment and monitor closely throughout therapy. Who should avoid this medicine? Patients with the following conditions should not receive cisplatin. Known allergies to cisplatin or other platinum compounds. Severe kidney disease, due to high risk of nephrotoxicity. Severe hearing impairment, risk of further hearing loss. Severe bone marrow suppression, increased infection and bleeding risk. Conditions where caution is needed. Special monitoring is required for patients with mild to moderate kidney disease, requires dose adjustments. Hearing problems, regular audiometry testing needed. Blood disorders, frequent blood count monitoring required. Mineral imbalances, electrolyte monitoring essential. Infection prevention, wash hands thoroughly and avoid activities that risk cuts or bruises. Fertility and pregnancy, cisplatin may affect fertility and harm unborn children. Reliable birth control is recommended during and after treatment. Breastfeeding, not recommended as cisplatin passes into breast milk and may harm the infant. Are there any age restrictions for using cisplatin? While cisplatin can be used in pediatric patients, special considerations apply. Children may be more susceptible to hearing loss and kidney damage. Elderly patients also require careful monitoring due to age-related decline in kidney function. Alcohol or food interactions. Patients should avoid alcohol during cisplatin treatment as it may increase the risk of kidney damage and interfere with the body's ability to fight infection. Adequate hydration is essential, and patients should increase fluid intake as directed by their healthcare team. Possible interactions with other medications, drug interactions. Cisplatin can interact with numerous medications, potentially increasing toxicity or reducing effectiveness. Healthcare providers must carefully review all medications before starting treatment. Overview of drug interactions. Nephrotoxic drugs pose the highest risk when combined with cisplatin. These include aminoglycoside antibiotics, amphotericin B, and certain diuretics, which can increase kidney damage risk. Ototoxic medications such as loop diuretics and aminoglycosides can increase the risk of hearing loss when used with cisplatin. Phenytoin levels may be affected by cisplatin, requiring dose adjustments and monitoring of anticonvulsant therapy. Possible impact when combined with supplements and herbal products. Patients should inform their healthcare team about all supplements and herbal products, as some may interfere with cisplatin's effectiveness or increase side effects. Antioxidant supplements may theoretically reduce cisplatin's anti-cancer activity, though clinical evidence is limited. How should cisplatin be stored? Proper storage of cisplatin is critical for maintaining drug stability and preventing degradation. Healthcare facilities must follow strict storage protocols to ensure patient safety and drug efficacy. Recommended storage temperature for cisplatin. Cisplatin injection should be stored at controlled room temperature between 15 degrees Celsius to 25 degrees Celsius, 59 degrees Fahrenheit to 77 degrees Fahrenheit. The drug must not be refrigerated, as cold temperatures can cause precipitation and loss of potency. What happens if cisplatin is not stored properly? Improper storage can lead to drug precipitation, loss of potency, and potential safety hazards. Refrigeration or freezing will cause the active ingredient to precipitate out of solution, making the drug ineffective. The drug should be protected from light and kept in its original container until use. Any unused portions must be discarded properly according to hazardous drug disposal protocols, and the medication must be kept away from children and pets at all times.